Maybe you sail through life with no effort at all and never have a thought about your mental and emotional well-being. Or maybe you're a person who's had one or two rough patches over the years, but generally lives a pretty balanced and happy life.
Or maybe you're like hundreds of millions of people around the world who have had feelings of anxiety and depression, feelings that were significant enough to talk to a doctor about.
Lots of people throughout history have lived with depression and anxiety. There's evidence to suggest that people like Vincent van Gogh and Michelangelo were suffering from depression for at least part of their working lives. It's been around, anxiety and depression, since the beginning of human existence.
According to Mental Health America, more than 17% of all young people in the U.S. between the ages of 12 and 17, and more than 32% of all adults have reported symptoms of anxiety or depression in 2023. And by the way, that figure is down 7 percentage points from the pandemic years.
Yeah, and the World Health Organization reports that roughly 350 million people on our planet suffer from the debilitating effects of depression. And this is probably underreported. In fact, it doesn't really matter what survey you look at or exactly how accurate they are. The key takeaway from all of this is that the rates of depression and anxiety are high. And while there are many treatments, some which are proving very effective, there is one big problem to solve.
We still don't know what causes depression. For some people, there may be some genetic component, some environmental stuff, but we don't know what causes it.
That was Dr. Elizabeth Lombardo. She's our guest in this episode and is a licensed practicing psychologist. She's also the author of several books. Her most recent one on depression and anxiety called Get Out of the Red Zone, Transform Your Stress and Optimize True Success. We wanted to talk with her about her experiences in helping people deal with anxiety and depression and with some of the newer treatments that are being studied.
Cognitive behavioral therapy, or CBT as it's often referred to, was originally developed by Aaron Beck back in the 1960s and 70s and has grown steadily in popularity because of the positive results that it's produced. It's sort of the clinical psychologist's de facto standard, along with antidepressants, when it comes to treating anxiety and depression, because it's more than just talk therapy. It requires patients to engage in practical applications to help themselves.
So it's good that we have CBT and antidepressants. They've both been around for the past 50 years or so. But one of the important things to know is that they are only about 50% effective. And the base rates for depression and anxiety have increased significantly during these past 50 years.
Clearly, the challenges associated with anxiety and depression aren't new, and yet we're still stuck with just a couple of treatment options.
And that's one of the things that we wanted to speak with Dr. Lombardo about.
A new treatment.
Ketamine therapy is being tested and researched around the world and has been approved in the EU for treating depression and anxiety. And while it has been approved in the US as an injectable short-acting anesthetic, it is currently not indicated for psychiatric treatments such as depression and anxiety.
The Food and Drug Administration urges people in the U.S. who are interested in ketamine to seek guidance and direction of healthcare professionals. You know, your doctor. Research from Europe indicates that small doses that melt under your tongue, what the therapists refer to as sublingual, show positive results in the treatment of anxiety and depression.
Welcome to Behavioral Grooves. I'm Kurt Nelson.
And I'm Tim Houlihan. And in this episode, we're going to try to unlock one of the mysteries of our behavior through a behavioral science lens. But before we get to our conversation with Dr. E, we want you to be aware of a couple of important things.
First, ketamine therapy is new. It's being studied and researched and shows promising results. However, it's not to be entered into carelessly. If you're interested, please do your research, talk to a trusted doctor or healthcare professional, and be thoughtful about how you proceed.
Also, if you are in crisis at this time and you have thoughts of hurting yourself or others, please dial 988. It's the Global Suicide and Crisis Lifeline. Now, you can use this anywhere in the world on any mobile phone. Just dial 988 if you want to speak to someone about getting some help.
And make sure if you are in maybe not crisis mode, but you are in a depressive or anxiety mode, check out and get a therapist if you can. It's really a great thing. Okay, with that out of the way, we want to encourage you to sit back and relax.
Seriously.
And enjoy our conversation with Dr. Elizabeth Lombardo.
Elizabeth Lombardo, welcome to Behavioral Grooves.
It's a pleasure to be here. Thank you.
We're excited to have you here, and thanks for joining us from Baltimore this morning. We need to know, first and foremost, maybe the most important question we're going to ask here is coffee or tea?
Tea.
Oh, yeah. Wow.
I'm 53 years old, and I keep thinking when I grow up, I'm going to start drinking coffee, but it hasn't happened yet. So,
do you drink coffee at all?
No.
You
Ever?
and Tim, you guys,
And
you're
I don't
all
drink soda. I mean, and
We're
I'm
simpatico.
annoyingly happy in the morning, and I have energy. But don't talk to me after like 9 p.m. I am done for the day. So.
I think that's fantastic.
that is a lot like
Whatever.
Tim as well. Look at you guys.
I've never had coffee, never in my whole life, but I love the smell of it.
I love the smell of it. The only time
love
I
the
drank
aroma.
coffee was I was doing a show, Steve Harvey. Remember he had a
Yeah.
show?
Yeah.
And TV studios are notoriously cold anyway, but his studio was so cold. I just remember everyone was wearing, heavy jackets, and I'm wearing, a short sleeve dress, so I look pretty on stage. And I was so cold. I did have a little coffee, and I didn't like the taste, but it warmed me up. So it was that or alcohol, and I chose that not to do that.
I think that's good.
Very
that's a good call.
wise choice. Very wise choice. All right. Second speed round question here. Are you more of a bicycle person or a unicycle type person?
Wow. Definitely bicycle. I do not have the balance for a unicycle, but I think it would be fun.
Yeah.
Yeah.
I'd be willing to try it in a padded room, I think.
In a padded room with wearing a helmet and everything else.
Yeah,
right?
exactly.
Yeah.
All kinds of pads.
Yeah, or like on a hay-filled field, that sort of thing. That's what comes to my mind. Okay, third question: would you rather go without your laptop or your mobile phone for 1 year?
I'm going to say my phone because I can still text on my laptop.
Now, out of all of those questions, that one had the most angst in your face.
Yes.
I often call my phone my third child. But I'm willing to give that up, I think, because I love to write, and not having my computer would be hard.
So my 14-year-old daughter had the part of her school, they had a big play and everything. They've been working on it for like 3 weeks. And so they just had the production last night, and she comes off. It was Midsummer Night's Dream, William Shakespeare, and she played Puck, and she did great and all this other stuff. So she's super excited afterwards. And then like you see her face just go like in utter terror. She realized that before they started, they had gone to this little bakery close by the school, and she had left her phone there. And so she didn't have her phone. And so, I mean, the terror of a 14-year-old without their phone. And of course, the place was closed. And of course, they don't, they say they don't listen to their phone mail messages. And so it's like, I don't know if she slept last night because of that. So,
oh my gosh. Terror.
I may cause an ER visit. I don't know.
Yeah, that's true.
I know.
True.
It's such a habit that we've become so accustomed to that not having it can cause all kinds of angst and anxiety.
Yeah.
Truly.
Okay. Last question here. Is it true, at least in the United States maybe, that we don't do enough to look and explore new ways of treating mental illness?
Absolutely. Yes, absolutely.
Yeah. Tell us about that.
There are certain companies that have a lot of marketing budgets, We'll just put it that way. And so, I think as a society, we tend to be very biomedical. If something hurts, you take a pill. And people do that a lot for their physical health, and it's really carried over to mental health. And yet, when we look at something like depression, meta-analysis study came out a couple of years ago saying that antidepressant medication was not nearly as effective as exercise for mild, moderate, and severe depression. That is incredible. And I don't know how many people actually know that. So the hard thing for me is that people are so focused on one way to treat that isn't always effective. The good news, though, is there are a lot of other options out there. And thanks to you all and people like you, other people are starting to really understand that.
And when you talk about sort of the one primary way, you're talking about talk therapy. Is that sort of the
No, I'm talking about medication.
Yeah. Just regular medication.
Yeah.
Okay. Talk therapy plays into this though as well, right?
So talk therapy is an interesting term because the general public, I think, thinks talk therapy is anytime you go talk to someone. And yet there are different theoretical orientations, which means there are different approaches, and they're all very different.
Yeah.
So for a lot of therapy, it's supportive, it's empathetic, it's tell me, wow, I'm sorry that you're going through that. That must be tough. And that is beautiful. But that isn't the same as something like cognitive behavioral therapy, which we know is very well supported in the research to help address things like depression and anxiety, because not only do you get the support, not only do you get the empathy, but you actually learn specific skills. If you think about something like depression, interestingly, in 2024, the year that we are in, we still don't know what causes depression. For some people, there may be some genetic component, some environmental stuff, but we don't know what causes it. We do know that something like cognitive behavioral therapy, when you start to change your thinking in ways that are healthy, accurate, and helpful, that depression starts to go down. We also know that when people engage in cognitive behavioral therapy, when they look at brain scans, the changes that occur in their brains are very similar to the changes that occur when people take something like an SSRI, when that SSRI was effective. So we can change our brains using something like cognitive behavioral therapy, but CBT is different from kind of quote talk therapy.
Yeah. And again, I think there's a lot of people when they think of therapy, they immediately go back to Freud and being on the couch and talking about your childhood and your mom and all of those different pieces. And therapy has moved well beyond that. As you said, CBT, you have a number of different kind of off branches of that as well that, again, are based in really sound research and theoretical underpinnings. And to that point, I love what you said originally, that this idea that exercise can be a therapy for people who are dealing with a variety of mental illnesses. It's not just, oh, I'm feeling a little down, let's go get some exercise. No, these are people who can come in and have a pretty severe aspect. And in some instances, exercise, changes in lifestyle, other factors. What else can people do? And what should they be thinking about if they are in a situation where maybe they're feeling, we all feel stress, but maybe they're feeling a little bit more stressed out today than their usual, a little bit more anxiety. And we can talk about some of that too. But what would you suggest? What do people need to do?
I would bet that a lot of people are feeling that. When we look at, how our society is doing, I mean, about 80% of people, and this is in the workforce, say that they're experiencing unmanageable stress.
Yeah.
Right. So, I mean, these are huge numbers. What else can we do? Well, there's a lot we can do, and that's the beauty of it. So exercise, definitely. Meditation. And when I say meditation, I know for some people that causes them stress just thinking about it. And I will, full disclosure, when I was in psychology school, I wrote articles in peer-reviewed journals on the benefits of meditation, right? It helps you think more clearly and have less stress and sleep better and have more confidence. And even knowing that, I would sit down for 20 minutes and think, am I meditating? I don't think it's working. I'm gonna get up and start doing. Having said that, I do meditate regularly now. Any meditation is better than no meditation. And so I just like people to know, a lot of times I think people think of meditation as, clearing your mind. you still have thoughts. And I always remind people the reason why your mind is still wandering is because you're alive. Yeah. And we really like that about you. So that's fine. I remember when I was getting trained in meditation, a specific type of meditation that my instructor told me about a study that was so helpful to me. And so I just want to share it. I like to share it with people when they're concerned about meditation. So they asked people to, they had people meditate and they put EEG leads on their head, right? So we can see the brain waves, we can see what's going on biologically. And then people meditated. And after they said, how was your meditation? And even the people who were like, I couldn't get into it, I was stressed out about my personal life, even those people had EEG changes.
Yes.
So even if it doesn't feel like it's working, it is working.
Yeah. I love that. I love hearing that, we have these blind spots. We have optical illusions and we have cognitive illusions. And that's a great cognitive illusion. It's like, no, that wasn't working for me. When in fact, it was really working for you.
Yes.
I think that's really cool. I'm kind of curious about just also following up on this idea about what are the things that we should be thinking about? Like, what are the new frontiers, I suppose, when it comes to treating stress, anxiety? If 80% of the workforce is stressed out, we've got all kinds of environmental problems that we may or may not be able to solve because they're just so big. But what are the things we should be thinking about individually?
Addressing your stress in ways that work for you. So there's a whole approach of ketamine therapy, and I know we're going to talk about that today. And that's a really powerful way that the research is really supporting, can be incredibly effective at changing not only depression and anxiety symptoms, but really rewiring our brains so we start to think in different ways. So that's something that's really powerful. On our own, I say look at what you need. Each person has things that they need to feel their best.
Yeah.
For me, it's exercise and sleep and meditation.
Yeah.
And even when my life is crazy, as long as I get at least a little exercise, I get even a couple minutes of meditation and I get my sleep, I can handle things. So figuring out for each individual, what do you need, and starting to apply it in your life.
So a big question that I think I have, and hopefully, maybe not hopefully, but maybe some of our listeners have, is so at a certain point, this understanding of what I need, you can do that on your own. You can experiment, you can try. But at what point do you recommend that people go and actually, you know what, I'm not able to do this on my own, and I might need some help. And I think there's a lot, particularly I will just speak as a older white male, a lot of hesitation with people of my gender and age that says that's failure if I need to go in and see somebody. And so I will, suffer through and just live with this when in fact that might not be the best case. So what are some of the signs? What are some of the things that you can point to for those people, who, they're trying their best, but maybe it's just not working. And at what point do they say, hey, I need something more than just me YouTubing some things?
Yeah. So, I just want to start with responding to that, just to remind everyone, when we think about physical health, think about it. When you think about physical health, what comes to mind?
Yeah. Going to the gym, running, exercise.
Going to the gym, exercise, right? When we think about mental health, what comes to mind?
Nothing.
People in white coats, Yeah.
Depression, anxiety, pathology. If you have a body, you have physical health. If you have a brain, you have mental health. Right. So first of all, let's just stop depathologizing all this. And it used to be, I can remember Dr. Cooper. I don't know if you remember Dr. Cooper, who started aerobics, group fitness aerobics. And people thought he was crazy to suggest that people exercise.
Yeah.
And yet now when you think of physical health, that's one of the first things we think of.
Yeah.
Right. So I'm hoping that there's going to be a real movement in mental well-being. And maybe that's a better term than mental health.
Yeah.
But I'm hoping that there's going to be a movement where we realize, why are we waiting for people to be depressed, anxious, overwhelmed with distress to get help? You wouldn't do that for your heart. Hopefully people aren't saying, hey, I'm going to wait till I have a heart attack to start eating well. Right? Hopefully we're saying we're going to do it now. So to answer the question of when do you know when to get help? First of all, I would say if you're asking, then that's time.
Yeah.
Yeah.
Symptoms to look at are, is your distress impacting your ability to function? at work, have relationships? Are you, is it impacting how you sleep, sleeping too much, too little? Is it impacting how you eat? Eating too much, too little? Is it impacting how you can function? You can't concentrate. You keep ruminating or thinking about these thoughts that aren't helping you. Now, we talked before about how there are different approaches to helping our distress. And I use the word distress. It's any emotion we don't want. So it's depression, anxiety, worry, anger, all of that. One of my philosophies, however, is that these are a lot of dealing with this, and I call it the psychological red zone when we have high levels of distress. A lot of dealing with this are just applying the skills. My grandmother was she was an incredible piano player. She never graduated from university, but she taught a course at the college level that she called How to Play the Piano Despite Years of Practice. Right? So she'd work with her students. She'd get rid of the habits that didn't work. She would teach them the right way to play the piano, and they would practice. And if you get rid of what isn't working for you, you learn what actually does work, and you practice what really does work, you actually can't help but get better, right? So she taught how to play the piano despite years of practice. I teach people how to be happy despite years of practice. Because a lot of us have tried, we've tried things. We think, watching 8 hours of Netflix, that'll make me happy. Maybe not so much. So, yeah. A lot of these are just skills. And if you haven't had the course, and this is when I work with my clients, I call it a course. If you haven't had the course, why would you ever know how to do it?
Yeah, right. That we'd have this expectations that, especially when it comes to mental well-being, that I ought to just be fine. That
we should all over ourselves. I should be able to handle this
constantly.
Yep.
And all those shoulds really get in the way. I should have done better. I'm sure that I will do better. I will. I want to do better, but I should have done better that time. Okay. But all that said, we are here. One of the things that we really want to talk to you about is ketamine therapy.
Ketamine, yes. And complete disclosure, when I first heard about ketamine therapy, I was like, well, that sounds really weird. And that sounds like drugs. And I don't like any of that. But I will say the research is really powerful in terms of how effective it can be when administered correctly.
Yeah. So
let's dig into that, because I think that's a big piece of this. First off, for our listeners who, ketamine has been in the news and it's been kind of highlighted in a lot of different areas, but many may not know what ketamine is. Can you talk a little bit about ketamine and a little bit of the history, and particularly as it relates in this arena?
Yeah. So ketamine, it's a psychogenic, medication. It was approved by the FDA actually in 1970 to treat, for analgesic purposes, anesthetic purposes. It was listed by the World Health Organization in 1985 as an essential medication. And one of the ways that we know that it can be really helpful is when it comes to depression and anxiety. And in fact, it was in 2000 that Yale came out with a pretty big clinical study looking at the impact of ketamine when treating depression. Now, we have to understand, again, how is it administered and how are people taking it? So when I'm talking about ketamine therapy, I'm talking about microdosing. I'm talking about very well controlled. We hear about people who die and have ketamine in their system, maybe too much ketamine in the system. So we're not talking about that, but we're talking about in a clinical setting, using ketamine as an adjunct to the treatment. And the research is pretty powerful as to what's out there. Mind Bloom, which is an at-home ketamine treatment, really, really cool concept of how they do this and how they really control it. In 2022, they came out with their own study, over 1,200 people. And after just 4 sessions, 89% of participants said that they had improvements in anxiety and depression. When we look at other pharmacological interventions, 50% is kind of max on what we get. So even higher, and just in 4 sessions. So it can be very powerful. What I want people to understand is we are very much talking, and I'm going to probably say it more than just these couple times, but it's about controlled use of ketamine.
Is this, so to what degree is this being adopted by what we might consider the more traditional medical community? There's always resistance, as you mentioned, with the aerobics example. Right? If it's new, there's going to be resistance. But to what degree are you seeing some kind of adoption of ketamine in sort of the traditional medical community?
Well, I think it's a couple things that we need to be, aware of. One is just that this research is relatively new. I mean, when I was in psychology school, not once was ketamine ever talked about. So the research is new out there, and then just trying to get it out in ways that, maybe ketamine organizations don't have the marketing budgets that some of the other interventions may. So having podcasts like this where people can find out the information without having to look in a magazine and see an ad for it, I think can be really powerful.
Yeah, it's interesting, isn't it? I mean, you said it was approved by the FDA in 1970. It was first synthesized in 1962. It's been around for a long time. So it's not a blockbuster drug being released by a major pharmaceutical.
Right. And, with all the psychedelic medications and what happened in the 60s and 70s and, all of that, and then it became all illegal, I think people put it into that category of illegal, shouldn't touch it, really bad, addictive drugs.
Right.
And that's not really what it is, especially, as we're administering it in the safe way.
So you've talked about this idea of being very controlled in how it gets used, microdosing, various different aspects. Can you talk a little bit about what a typical ketamine therapy looks like? How do people get into it? How does it work? What would they expect?
Yeah. And so, I come working with Mind Bloom, which is an at-home ketamine treatment. There are other approaches out there, which I obviously can't speak to because I don't know much about them. But I know at Mind Bloom, it's very controlled in that first you do an assessment. Is this the right medication for you? We want to make sure. And then you meet with a clinical psychiatrist or a nurse practitioner in psychiatry, where you have a full assessment. Now, this is all done online, but it's still a licensed clinician. Once that happens, you get information about it. They send you the medication, and it's actually sublingual. So with Mind Bloom, it's not an IV, it's sublingual. And you start with 3 tablets in your mouth. You keep them there for about 7 minutes. You don't swallow it. You spit it out after 7 minutes. So it's sublingual. And then you go into kind of a relaxed state. It's not hallucinogenic. You don't have crazy trips on it or anything like that, because it is very controlled. And especially the first, time is a much lower amount to really see how did you react to that. So we have a guide who you meet with before. You have someone with you while you're getting it, while you're doing the treatment, just in case something happens, and nothing really happens, but just in case. After your first treatment, you meet with your guide again. This is what happened. This is what I liked. This is what I didn't like. You meet again with a psychiatric professional. Here's how it worked, and they adjust the dosing. So people are with you the whole time. One of the reasons why I really like the Mind Bloom program is it's not just ketamine treatment. One of the ways that ketamine can be very helpful is it helps to rewire our brains. And with the Mind Bloom program, and I recommend if anyone's doing ketamine outside of the Mind Bloom program that they consider this approach. What Mind Bloom program is we prime your brain before, right? We give you some training to start to prime your brain, whether it's, about handling your depression, if it's, becoming unstuck, that kind of thing. Then during the treatment, you're actually listening not only to music, but you're listening to suggestions that will help rewire that brain after we give you a specific action step. So when your brain is on this ketamine and it's forming new neurological pathways, we then give you a specific action step. Here's what you do this week to keep going forward in this goal that you have. And so with all of that, the ketamine is a part of a more comprehensive treatment.
So what do you think the circumstances are that, or the situations or diagnoses, for lack of a better word, are best for ketamine therapy?
Yeah, so it's approved for depression and anxiety. It is off-labeled for things like substance abuse, chronic pain, PTSD, grief and loss.
Wow.
And there have been some benefits demonstrated with that, but we don't have enough research to be able to say this is a diagnosis that you want to take ketamine for. Even something like chronic pain. So I used to work a lot with chronic pain. Chronic pain is pain that people experience for over 6 months that it doesn't change from conventional treatment. And we know from a lot of what's going on in our society in terms of addiction and how people start with pain medication and then they get addicted and then they can move on to other things. And it's, it is just heart-wrenching what people are going through just by trying to treat their pain. So if we can have something like this, and again, it's not on label, so I'm not saying it, but I'm hoping, we'll start to get more research on it. Then we can really be helping people. You couple that with the cognitive behavioral therapy or some of this training, and we can, I think it'll be really, really powerful.
So how long is a typical, again, depression, anxiety? What would be a typical length of therapy with this? Is this something that I will be using for the rest of my life? Is it something that you use for, a month and you're done? Does it depend upon the situation, the patient, and everything else?
Yeah, I mean, that's one of the beauties. The study that Mindbloom did, it was just after 4 treatment sessions that 89% of participants got better. 4. Like that's incredible. And because the whole mechanism of action is we are rewiring brains. It's not like maybe a conventional SSRI medication where it has to be in your system in order to be helping you. Because ketamine actually is helping to rewire your brain, the goal is that your brain becomes completely rewired. And so instead of thinking in depressed ways, instead of that being your go-to way of thinking, you start thinking in different ways.
Yeah, it's not probably a one-use instant change for the rest of your life kind of thing.
Probably not a one use, but again, if after 4 sessions, 89% of people said that they were better, that number is staggering.
Yeah,
I mean, in the world of psychology, that's a really wonderful thing to see after just 4 treatments.
And is there much data on sort of the longevity? So that do we have the expectation that if you're feeling better now, you'll be feeling better a year from now, or 2 years from now, or 5 years from now? I mean, and the world changes around us.
Yes. Yeah, of course, the world changes. And yes, that's the beauty. Because again, if we're rewiring our brain, and we keep thinking in that way. If you think of every thought as just a nerve firing in a certain pattern, right? And there's a saying in psychology, nerves that fire together, wire together. So when it's wired together, that's your automatic thought. That's where you go to. And so if we can have your new go-to thought going from life is horrible and it's never going to get better to, hey, it's a challenging time right now and I know I can handle this. If that's actually how your brain tends to think, then and the more you think like that, the stronger it gets and the more likely you are to continue to think like that.
So you talked a little bit about like the process that Mindbloom does, and I'm assuming that most other people or physicians or that are doing this are probably doing at least some other. It's not just here's your ketamine, go, but you're pairing that with some other really powerful and good interventions, right? As we're thinking about this. So you talked a little bit about some of the pieces, but I know you also talked at the beginning about meditation. You talked about CBT, different aspects. What have you seen works really well in this type of combination? And what are some of those pieces? And can you talk about that?
So I will speak from my own personal, clinical, what I see and what makes sense to me. But I have not conducted research on it.
That's
so just
fine.
want to say that.
People note this is our anecdotal information here. Yeah.
When we take the ketamine, we actually go into a meditative state, right? We go into that theta, the brainwaves. And so we're in that meditative state. I can't speak of the other courses, but I know the course that I created for Mindbloom is completely based in cognitive behavioral therapy. So it's actually getting a little bit of all of this. That's the real beauty, because when people are using the ketamine, when we're in that theta brainwave state, that's when we're much more suggestible. That's when that part of our brain that says that'll never work, that's not true. It's turned down a little bit. And so we can really hear this different way of approaching, different way of thinking, different way of acting. And again, with the ketamine and the repetitive thoughts about it, these new thoughts that we have and the behaviors that then we engage in, it allows that to be a more long-term rewiring your brain. So you start to not only feel better, but you're thinking better.
What should we be careful of? What should we be looking out for?
Well, I think you want to make sure, first of all, there are no contraindications. So something like a bipolar, someone who has schizophrenia, they're probably not a candidate for this kind of thing. Okay. We also want to make sure that we're not saying it's the magic drug, right? I'm going to take ketamine and my life will be great. It's a process. And ketamine is a part of developing that healthier lifestyle to address your mental well-being. We want to always have parts and habits that we are using in our lives to be healthier for our physical health and for our mental well-being. So I think we just want to remember it's not one and done, my life's completely different, but it'll get you on that path and to be able to perpetuate it by engaging in healthy and helpful activities.
I love this idea that, we're all attracted to miracle drugs. We can't help but, I can't help but feeling like, man, if there was just one thing that would just take care of this one issue in my life and just ameliorate it completely, that would be fantastic. At the same time, it's all those too good to be true stories are literally too good to be true. So having this rather common sense approach to say what ketamine is doing is helping put you on the right path is a pretty balanced and cool way of thinking about getting healthier.
Yeah.
What are some of the misconceptions? And again, I'm just from what I've heard on news reports and other things, I think there is obviously lots of factual data out there, but then there is probably a lot of false, misleading data, or just things where it's true, but it is a offshoot that is totally separate from what you guys are talking about.
Yeah. So, I think it was interesting. I just was with a client and we were talking about ketamine therapy. And the first thing that this client said was, well, will I become addicted to it?
Yeah.
And that's not really, again, with this microdosing, it's different than perhaps what some of the celebrities who we hear about who have had ketamine in their system, particularly when they are, in their autopsy. That's a very different approach. So this microdosing really, I can't say because I haven't seen exact studies, but it's not an addictive thing. It's not a state where you're going to be in this trip for, hours and days and won't be able to control yourself. And you're aware while you're doing it. You can still function. If someone came into the room and said, hey, there's a fire, you're going to be able to get out. So it's a lot less mind altering in terms of a scary way.
Yep.
And one of the things we really talk about at Mindbloom is to to really trust and let go and be open to the experience, but knowing that the dosage that you're going to be getting is not going to be that, again, that huge tripping, hallucinating, having conversations with devils, that kind of thing, which is good.
That is good.
Yeah.
I'm just going to let's put that on the good side of the tea
No
table.
conversations with devils. Okay.
Right. And my gosh, if the size and scope of the anxiety is reaching 80% of people who are getting up and going to work every day, this is really a big problem to solve. I gather from sort of the way that, the fact that we're having this conversation, that ketamine is relatively new to you.
Yes.
Right. And what, certainly, we're going to be sharing this podcast, but what do you think needs to be done? What would be an effective way of getting the word out? In a safe way? What
I would love is for healthcare professionals to have more of this information. How many times when we look at, for example, I think it's about 90%, but I don't have the stat on me, of psychogenic medications for things like anxiety, depression are prescribed by primary care physicians. And when we look at the statistics of how often those prescriptions are not the right ones for the individuals, it is heartbreaking and staggering. So if we could do one thing, it would be to share the research with primary care physicians to let them know that this is not only an option, but there's a lot of efficacy in it. So I think a lot of it is about education, and it's about educating that this is different than LSD, hallucinating, going on, a 3-week trip, psychological trip. Yeah.
Yeah. And that there isn't a big company that just poured a ton of money into developing it that now has a patent on it that is going to exploit it. So they're going to advertise the living daylights out of it on all the shows that, they think are going to appeal to.
Yes. or increase the price by 3,000% because they have the patent. Yes.
Yeah. Or have a sales force of, 3,000 salespeople going out there and talking to all those primary care doctors and getting in their, in their offices, twice a week. So.
Yeah.
I also think, on a more of a grassroots place, as people hear about this podcast and they maybe look at some of the research, if that's what they're interested in, that they share it with their primary care physician, particularly if they have an experience where they benefit from it or they tried it themselves. And so, having conversations, helping to demystify, ketamine therapy and how effective it is important too.
It's always interesting to me. We think of doctors, maybe I'm overgeneralizing. So forgive me if I do that, but I often think that we put doctors up on this pedestal of that they are the epitome of all knowledge as it relates to health and wellness and all of that. And we do work with medical systems and different pieces, and we all know doctors, hopefully on a personal level, not just the doctor that you're going into. And they're human; they're just like we are. And this idea that, they have gone to school and they've studied and this is their area of expertise, but they are not they don't have an orb that shows every single thing that's out there. And so by being able to bring things to them, hopefully you're expanding their knowledge base as well. So.
Yeah, that's exactly it. And when you look at medical school, maybe not now, but I mean, I used to be a physical therapist. So I went to a physical therapy school and we had a lot of classes with the medical school. And this medical school is very well known for being very mind-body oriented. And yet, it really was primarily psychopharmacology that they were learning about when it came anything to do with mental well-being.
Yeah.
So that's a lot of what's being taught. So I mean, having an MD, people with an MD, any kind of doctorate, they have a lot of education in that field, but it doesn't mean that they know everything.
Yeah.
Yeah.
Okay, Elizabeth, we've come to the point in our conversation where we're going to get very serious about music. And so we want to find out, let's assume that this is you sequestered on a desert island for a year, and you get to take 2 musical artists' catalogs with you, everything that this artist has ever created. So it's not like one song or one record or it's a lot of stuff.
Okay.
Which 2 are you going to take with you? And again, this is maybe the most serious part of our conversation today.
Okay, and so this is just on the spot, so I'm just going to tell you what came to my mind, right?
This is not a go to your grave decision, by the way.
Okay, okay. I just want to make sure. This is not maybe my final answer, but I will share with you my answer.
Okay.
The first person that came to mind was Bruno Mars.
Oh,
great one. Great choice.
He's so happy. He's so energetic.
Yeah.
I just, even if I couldn't see him because I could only listen to his music, I could picture his smile and he just seems to love life. And every time I listen to his music, it just elevates me.
Good
so
grooves.
I will say Bruno Mars.
Okay.
And I think my next one would be Maroon 5.
Maroon 5.
We have many decades worth of that. And and so
deep catalog.
Yeah. Tim, have a question for you on catalog inclusions. All right. So Bruno Mars did one of my favorite all-time SNL skits, where he ended up where it was the back room of Spotify or one of those places, right? And their system went down, but they so we got a request for Michael Jackson, and Bruno then would live sing that for a while until they skipped, and then they would do a different song, and then they would do a different. It was amazing, and he hit all these different artists, and was just wonderful in that. Does that count as catalog? Can I take that SNL skit piece along with, or can Elizabeth take that along with her?
So if you're giving me the official, if you're endowing me with the ability to make that decision,
you are the catalog judge to say what fits in this catalog or not. Yes.
I'm going to say yes.
All right.
Yay! I feel like I won.
Because
the judge has ruled.
Because the artist performed it.
Yeah.
Right.
Yeah.
So that's good enough. So it doesn't just have to be original, it doesn't have to be just a Bruno Mars written composition. Anything that Bruno Mars ever created.
it was a TV show as opposed to a record recording. That was where I was kind of going with that.
Still singing.
Yeah, he's still singing. So it's like the performance on somebody does on the Grammys, or one of those. That would be able to go with you, huh?
Yeah. Okay,
well, you're setting precedents now, so this is here.
I feel like this was a Supreme Court ruling.
All right,
we will come back to this in future episodes.
So, Elizabeth, I have one other musical question. I don't normally ask the musical questions, but I have one as it relates to the work that you do. Music obviously has lots of different qualities and various different pieces. So you talked about exercise, you talked about sleep, and talk about different things. is there any in the experience, or at least in what you've seen maybe others doing, any music therapy that people have out there? And you may not have any insight on that. So
No, I'm laughing because absolutely. And it's funny because I mentioned that concept of the red zone. And when I am speaking, I'm a professional speaker, when I'm with my clients, one of the things I often recommend is that you have a get out of the red zone playlist. A playlist of songs that for you, either they bring you back to a happier time, you like the lyrics, you like the beat, and have that playlist. Because when we're overwhelmed with distress, it's really hard to think, I wonder what musical selection would help me feel happier right now, right? But if you have that go-to, you just hit play. And by the way, if you hit play and dance around, then you've got movement.
Even better.
If you hit play and dance around and you dance like me, you're laughing. And laughing is also another great way to have less distress in your life. So music is very, very powerful for sure.
I'm assuming that Bruno Mars might be on your Get Out of the Red Zone playlist. All right.
You bet.
Right.
And if I could move like him, I'd be really happy. But you know what? If I'm stuck on a desert island for a year, maybe my dance moves might get a little better.
You dance like nobody's watching because nobody is out on that desert island.
No one is. That's right.
We oftentimes get to ask our guests about something that's near and dear to our hearts, and that is finding your groove. We've named the podcast Behavioral Grooves, not just for the music, which everybody goes to, of course, first, but for the idea of having these mental grooves, our habits and our routines, and what leads to a fulfilling and rewarding life. And so this is kind of another on-the-spot question, Elizabeth, but are there things that you do to keep you in your groove or to help you find your groove?
Absolutely. To be my best, exercise is always a part of my day. Meditation is always part of my day. That sleep, very important to me. But also it's where are you focusing your attention? There's a lot of, I'll just say, stuff going on in the world. And often when I work with clients, they'll say, oh, but of course I'm just stressed because of everything that's going on in the world. And while that can certainly impact how we feel, realizing that where we focus our attention is actually going to really play an important role. So personally in my life, my husband, the love of my life, we've been together for over half my life. He has ALS, and for the past 7 years, he's been on a ventilator, completely paralyzed, nonverbal. Super easy to go into a really distressed state, knowing that he could die any day. I don't deny that. I don't pretend that isn't happening. But what I focus on is more, what can I do now? How can I enjoy my time with him? How can I live a purpose-driven life? How can I cultivate relationships with him and also with other people that bring fulfillment to me? So I hope that people realize that, yes, even during challenging times, we have a lot more control than we may be aware of. And we can be really empowered to ask that question and then answer the question, what can I do? There's a lot we can't do, but there's also a lot that we can do. And so focusing on that for me is very powerful. And when I share that with my clients, it's very powerful with them.
It sounds to me like there's this aspect of being very purposeful in how you approach your thinking mindset component. And I know for many people, they strive, they strive for that, but it's difficult, right? You talked about the world, breaks in, you got, your boss yelling at you, and it's hard to just kind of go, oh, well, I'm going to take the good out of this. So what are the things that you found help you to be more purposeful about that? Obviously, I'm assuming you might be saying meditation. I think that is one of those big pieces. But are there other things, or how do you use meditation if that's one of the aspects?
Yeah, I mean that's one of the aspects. But there's that saying: "You are what you eat. You are what you think." And we get to control what we put into our minds. It's not always easy, but we can. One thing to do, and I kind of laugh as I say this because I am on news shows. Don't watch the news. Research out of Harvard shows that watching the news for 3 minutes in the morning, just 3 minutes, increases your chance of having a bad day by 27%. I'm not saying no social media, but ask yourself, how do you feel when you're on social media? I rarely get on social media, and there's really only one or two things that I get on. And when I do, my mood gets elevated. For a lot of people, they spend a lot of time on social media and they feel worse about themselves. The anxiety comes in, the depression mood comes in. If that's you, stop, or at least cut it down. What you fuel your mind with really does impact you. And so be very purposeful about that. When we go from awake to asleep and asleep to awake, Our mind is very suggestible. Our subconscious is always a sponge, but it's even more of a sponge. And whatever you think of a sponge, you put it in water, it absorbs water, right? You wring it out and put it into, a pile of milk, it absorbs the milk. Not once does a sponge say, I don't do dairy. Our subconscious is like that. Our subconscious is like that. Whatever you give it, it will absorb. So make sure you are being very purposeful in what you are putting in your mind, particularly first thing in the morning and last thing at night.
Oh, fantastic.
Dr. E, thanks so much for being a guest on Behavior Grooves today.
Thank you. It's been so fun.
Welcome to our grooving session where Tim and I share ideas on what we learned from our discussion with Elizabeth, have a free-flowing conversation, and groove on whatever else comes into our anxiety-filled brains.
Oh, man.
It's
been there, done that.
I know. I mean, I think we both have had bouts, right, of this. I know you've had some pretty, serious ones where you've actually gone and seen
a therapist.
Yeah. And it's one of those pieces that, as we talk about in other episodes, but different pieces, we generally as a society still do not talk about mental illnesses, depression, anxiety in the manner that we should, right? It's still taboo to a certain degree.
And I think part of that stems from this idea that mental illness is somehow different than physical illness.
Yes.
Right? That there's this myth that if you're depressed, that's nothing at all like having cancer,
right,
or having a blood disease.
I mean, you can just work through it. Why don't you just toughen up and just deal with it? Come on. It's like,
because it's not. It's the same. It's got the same biochemical, physiological roots as all kinds of other diseases.
Yeah.
And so that is something that I'd love for our society, our world, to get more comfortable with.
Right.
Just talking about it.
Right.
So.
And I think it's really important to note that hopefully listeners, that you aren't going through any of this, that you don't have it, but you probably know somebody, right? You probably are dealing with somebody, and you might not even know it because of that kind of component. And I do want to start off, look, we are not physicians. Tim and I are not clinicians. We don't research this area at all.
No.
We are science communicators, and we're here to share a very small bit of information that we know about ketamine and your options and different pieces of that. And it's based on really just this conversation with Elizabeth and some, background Google research. So don't take our word as gospel, because it's not. You need to go out and research it for yourself and be very, very careful about any way. Again, just like you wouldn't treat cancer by going to some, weird alternative medicine without really thinking about it. Make sure you study this and do other things. So
yeah, it reminds me, I have a brother who has had a debilitating disease for many years, and he ended up getting into some really wild stuff like dental implants and neck braces and a whole bunch. And he went to Lourdes and was prayed to be healed, and a whole bunch of unconventional things. But that's after he went through a lot of kind of traditional medical, tests and analyses and those kinds of things. So if you have concerns, at least start with the traditional medical establishment.
Exactly.
Would be my recommendation.
Exactly. And one of the things that I think is really important as we think about this is that, just like your brother did, is we explore the traditional, because those have been tested. They have been, they've gone through the rigors that, you're probably not going to have significant long side effects, like long-term side effects that are going to be debilitating. They've looked at that. They've discussed that. We don't know on some of these other pieces, but I'm very happy that they are studying these things, and that, treatments that have been on the fringe and are looked at as alternative have become more have actually, if they've proven to be effective, get put into the actual tool bag of physicians. And that's what I think is really exciting. And this is what I think some of the research that's going on with with what they're studying with ketamine, what Dr. Lombardo is studying, as well as others around the globe. That's the exciting part. That's going to hopefully lead to really well-researched treatments that we can point to that can improve. And again, we need to improve. I mean, the stats on this are crazy.
Right. And why do we care so much about depression and anxiety? There's two things that strike me that I want to point out. One is that it has a negative impact on our productivity, both in our personal lives, but also at work. The World Health Organization estimates that 12 billion working days each year are lost globally because of depression and anxiety. 12 billion working days.
With a B.
12 billion working days every year. So that means if we have every person on the planet, they're taking more than one working day off per year because of depression and anxiety.
I'm doing a quick kind of look here. Oops, I can't even get 12 billion on my calculator.
It's a lot. It's almost 1.5. Or it's a little more than 1.5 per person on the planet. So it's a big impact on productivity, not just at work, but also just in your personal life.
You know how many years that is?
12 billion working days. How many years is that?
32,876,712. 32 million years. Humans weren't even around then. There were dinosaurs like roaming the world at 32
million years ago.
Years ago.
And that happens every year. That we use 12 billion working days every year to depression and anxiety. So
okay, so you said that was one thing, this idea of lost productivity from a work perspective, but also in your life and just the things that you want to do and the way that you want to live your life. What else?
The other thing is that it's a major depression and anxiety are major contributors to death by suicide. So like, hey, if you're suffering, let's, get help, because we want people to stay alive and live happy and productive lives. But that's the big message there.
Yeah. And again, those rates have been going up. According to the National Institute of Health, in 2000, there were about 10.4 deaths per 100,000 people by suicide.
That's 10.4 deaths per 100,000, right? So you're saying of 100,000 people, roughly a little more than 10 people were dying by suicide in 2000. Okay.
And in 2022, there were 14.3 deaths.
That's like a 40% increase.
It's crazy.
Yeah.
And so when we think about the impact that depression and anxiety have, it's huge. It's huge so those people that, are losing productivity, people who are just debilitated by that, and then just the deaths that associated, and then the people who are left from those, right? That have to deal with the results of all of that. So one of the things, and I appreciate what Dr. Lombardo is doing here, is this: we have to be better at being able to treat people. And as we mentioned in the beginning, CBT, antidepressants, they work for some people. They're good, but they're not the be all end all. The effectiveness rates of those are not 100%. And so any improvement, and again, one of the things that I think is important is, everybody is a little bit different in this, right? As you the way that your brain reacts is different than the way that my brain reacts. And so, there are different treatment options for different people, and the ones that if we can find what works for who, then that's all the better.
What didn't Elizabeth say? She says that for her, the way that she deals with those challenging times are exercise, sleep, and meditation.
Yeah. So she said, here I'm going to quote, look at things, look at what you need. Each person has things that they need to feel their best. For me, it's exercise, sleep, and meditation. And even when my life is crazy, as long as I get a little bit of exercise, get a couple minutes of meditation, and I get my sleep, I can handle things. Yeah. Right? Yeah. So, which is important. And I think for our listeners, one of the things, so for you, Tim, what do you need to do? Obviously, you've as we've talked about at the beginning here, is that you've experienced some bouts of depression and different pieces. So what are you doing in order to make sure that those don't reoccur?
Well, before I answer the question about exactly what I do, let me give you just a little bit of history. That almost 20 years ago, when I got divorced, I got clinically depressed and started with antidepressants and talk therapy, and that led to CBT, to some cognitive behavioral therapy. And so I started to get the tools to kind of pull myself together, and that laid a really nice foundation so that during the pandemic, I had a bout of depression, and I did revisit my therapist just for sort of a check-in. But more importantly, I revisited the CBT worksheets.
Yeah.
And that was really, really helpful for me to work through distortions and things like that.
So and I know that this is like, explain thermodynamics in just a short thing. Explain CBT. I don't think we really got into it. So can you summarize what cognitive behavioral therapy is for listeners if they're not aware?
So I don't have a clinical explanation here for you. This is just going from my own experience with it. It's a set of tools like worksheets that you sit down and say, okay, what am I feeling? And I might be feeling like nobody loves me, everybody hates me. Let's start with everybody hates me. And that's the problem that I'm having. And so then it asks the question, well, why do you feel that way? Like, what's your evidence of that? And is there any counter evidence of that? And then you have to write this stuff down. You can't just answer it in your head. You have to write it down, which of course is part of the cathartic part of the therapy, is actually writing things down. And then what are the counterpoints of that? Is there any evidence of that? And then look for the distortion. Everybody hates me. Well, how many things in our life are everybody or nobody?
Right.
Are 100% or 0%. If we go back to Annie Duke's Thinking in Bets, life is there's a lot of gray area. So let's start to give some percentages. So that's how it works. And just by doing that, it actually minimizes and sort of reduces the impact of what those crazy statements are, those voices in your head.
In your head, right? That self-talk that is constantly kind of in a downward spiral at that time. All of a sudden, the real world evidence of you writing down, it's not everybody, right? Even if it,
right.
Okay, Kurt doesn't hate me. I know that. My wife doesn't hate me. All right. Everybody else does, but nobody, no. But it's that real world evidence. And then you do realize, as I talk about in workshops when I do with clients all the time, our brains like to fool us. Our brains, it's amazing how many times they fool us. And so you have to fight back. You have to fight back against your brain sometimes. And I think that's what cognitive behavioral therapy helps you do. It gives you tools to say, F you, brain. You're not fooling me again, right? So
I have a friend who says those voices inside your head, they're there to lie to you. So don't listen to them.
That's true. Yeah. All right. So thank you for the little primer on CBT. So talked about the history background. But so now what do you do? What are ways that you build immunity up around this?
Yeah. It reminds me of Andy Norman's, the conversation that we had with Andy Norman. We talked about mental immunity. That was episode 262.
Oh, look at you.
How about that?
Go. Way to have that stuff at your fingertips.
So that mental immunity, that ongoing thing for me is like getting out in nature, walking in the woods, being in the yard, just not just on the street, but actually getting in an environment where there's more natural world than man-made world. Enjoying the sunset, really focusing on the sunset or the sunrise or the sky, having those moments of nature. That
Yeah.
for me. How about for you, Kurt? What's your key?
So what I've found that works really well for me recently has been breathing type exercises. This idea of long, deep inhales with even longer exhales, which actually slow your heart down and release different hormones. So if I start feeling that little bit of anxiety, that little bit of stress, I will go and I will do breathing exercises. I will do non-sleep deep rest, 10-minute kind of things to do that. In addition to that, I also realize, like getting out and getting outside, getting a walk, getting exercise in there. Sleep has become, obviously, we've talked about my sleep issues in the past, but if I get a good night's sleep, I realize that's better. And then the last piece, that to your degree, like it's that the savoring things, having gratitude about things. It's really been wonderful to focus in to say, I am going to just stop and focus in on a mundane thing in my life and be really grateful for it. Because when you think about those mundane things, they're not so mundane. They actually have, I have a fantastic family. I have, a wife who loves me. I have kids who, piss me off sometimes, but man, they're good kids. They are fantastic, right?
Yeah.
I have good friends. I have job that I like most of the time. Again, those things that you often just don't appreciate. And if you just stop, take a moment to savor that, what you have, and really appreciate it, goes a long way for me. So,
and you can do that in silence, or you could do it with a song in your ear too.
Look at you bringing music in. There you go. Music. It's really good. Yeah.
Yeah. And interestingly enough, in my own personal journey, music is not always a get out of jail free card. Most of the time it is, but there are times when I've been really down, when music has not caused me to spiral more, but just hasn't lifted me up.
Interesting.
So
it's because you haven't listened to Ministry when they're screaming about, I'm going to rip your head off and I'm going to shit in your neck, and you realize, God, my life can't be nearly as bad as theirs, right? Just can't be, because that's just, you got to listen to that really anger music, Tim, to realize how good your life is. And then you go, oh, hey, not so bad.
Not so bad. Okay. Yeah. All right. What do we have to say about ketamine? It's great, right, that we have this new potential tool, but what did you want to say?
So I'm just really happy, and I think we talked about this already, that I'm really happy that we're researching this stuff, that we are looking at not just ketamine, we're looking at a whole bunch of what had been kind of identified as recreational drugs, mind-altering drugs that had a bad, had been kind of off limits for study in some cases because of the potential negative recreational use and addictive qualities of some of these, and some of the cultural pieces against that. And I think those are breaking down. Yeah. And what is really, really exciting for me is that they offer an opportunity. All right, they may work, they may not work, but let's get some research out there and let's study this stuff.
You're talking about like MDMA and psilocybin, and in addition to ketamine. Yeah.
Even just cannabis, right? I mean, it was approved for medical use before it was used for, is now being, adopted in many states as being recreational use as well. But I know people who use that to help them sleep, to overcome anxiety, a number of these things. So there's lots of research going on, and that is positive. And it's not just research that is looking at the next antidepressant. And so I find that fascinating and hopeful.
I just want to give 2 thumbs up to that. I'm with you. I think that's a really great thing that the medical community is continuing to push forward. I think that's terrific.
Yeah. And one of the things that Dr. Lombardo said, and again, I think there needs to be a lot more research on this, but, she was talking about, hey, look, 89% of microdosing ketamine patients report positive effects from some of the work. That's fantastic. 89, that's 90%. That's 9 out of 10 people. That's fantastic. And if that holds true, wow, think about the impact that can have.
Yeah. Again, compared to base rates of like 50% success rates with CBT or with antidepressants. So I couldn't agree more. Yeah.
I think the last thing, and we talked about this up front, is look, we aren't clinicians. We aren't, so we don't know this. And, you do need to be wary and make sure if you are going to be exploring this, do it with a professional. Don't just go out and try to buy some special K or Kit Kat, as they call it, ketamine on the street, right? Yeah. It can lead, ketamine as can actually be abused. I mean, if you take too much of it, if you use it with other types of drugs, it can actually lead to death. I mean, you hear about those stories in the news all of the time. And again, if you're not working with a physician on this, the likelihood of you actually being able to understand exactly what you need to do is a lot closer to 0 than it is to 100%. And so really make sure you do this safely with the help of a physician.
Good call out, Kurt. And if you're interested in exploring more Behavioral Grooves content along this idea, we had a wonderful conversation with Daniel Bergner in episode 305 about changing our minds and how he dealt with the mental illness of his brother throughout his lifetime, and had some really interesting things to say. Episode 255 with Daniel Almeida was one of the most interesting discussions that we had on the neuroscience of mental illness. Absolutely fascinating.
Yep. Yeah. And then there's Michelle Seeger, Why the Best Choice Can Sometimes Be an Imperfect Choice. And that was episode 340. Andy Norman, who you already mentioned, about, why we are more vulnerable to harmful conspiracy theories than we think. And this idea of mental immunity and helping against conspiracy theories, but also just mental health. That's episode 262. Also, Chester Elton, who Anxiety at Work, Why We Feel It and How to Manage It, which was episode 256. So go back if you're having questions about this or know somebody or feel yourself. Some of these are very helpful insights and will give you people who have studied this a lot more than you and I, Tim. So
Absolutely.
And if you're in crisis, make sure, again, dial 988 on your mobile phone anywhere in the globe and get the help that you need.
Yeah. Check out the other episodes, and we hope that some of this conversation will help you this week as you go out and find your groove.